Well, if it's Friday, it is time for the About Mansfield Consumer Advice Series. I'm Steve Casillo. Appreciate you being here today. Right now, it is 9 a.m. on Friday morning. Right now, we are live on Facebook. You may be watching this on YouTube. You may be watching this on LinkedIn. You may be listening to this on the About Mansfield podcast. But right now, as we do every Friday morning at 9 a.m., we talk about your health, and specifically with our guest, as we bring him in, there we go, the smiling Dr. Joseph Adams from Calibration Chiropractic and Functional Health right here in Mansfield, Texas. First of all, say good morning to the audience.
Hey,
All right.
morning.
This Sunday is Easter. You have got any plans for the weekend?
Oh yeah, man. We're like trying to stuff like 300 eggs for two kids. I think we're going a little overboard, but it's going to be fun. My daughter is almost 2, and I think she's going to lose her mind. It's going
Well,
to be fun to watch.
the kids are at that point, yeah, where Easter is really fun, and my kids are grown. They're both in their 20s, and Easter is like, okay, we'll go to church, we'll pay our respects, and do all that. But yeah, now it's all about the carrot at the end of the stick, the ribeye dinner. So that's when the kids get older, you'll understand that it's like, okay, it's no longer for them. It's now about mom and dad.
Yeah, I like it. I like that.
So we're not here to talk about Easter or dinners or Easter eggs. We are here to talk about, again, our continuing series on migraines, and specifically today, what are your options when you're right in the middle of a migraine? We haven't even touched on that. We've talked about hormones and the physicality of the muscles but what to do when the migraine has already started. What are some things that people can do when a migraine's in progress?
That's a very good question, Steve, because when you have a migraine that's starting up and or you're actually having head pain, that's obviously a very stressful, painful time, and your options are limited. When you're using pharmaceuticals, the window on those triptan drugs and some of our new gpant drugs that have been developed is right away. So if you're having a aura or a prodrome, which is the window between or before head pain sets in, taking the medications is absolutely essential in that early phase. But there's other things that you can do and that aren't pharmaceutical, and that's the stuff that I want to talk about, because somebody who's taking care of a lot of migraine patients, you realize that some of these migraineurs that have been dealing with this for decades, a lot of them stopped using pharmaceuticals at some point because maybe it didn't work as good as it needed to, and that's pretty common. They only work for maybe 40 to 60% of the population. The costs can be high, and if they're improperly taken, it can lead to worse migraine symptoms because of medication overuse. And so it is a area that we need other options than just pharmaceuticals, because most of these migraine patients are looking for complementary and or alternative approaches because they're not getting the relief they need with pharmaceuticals alone. So that's just the nature of the disease, if you will, in
Sure.
the industry, unfortunately.
Okay,
So
and going the chiropractic route, that would be in a sense a homeopathic route. Would that be? Is that true?
I mean, I don't know if you would say it would be like homeopathic, because if you want to get technical, I mean, homeopathy is really the study of treating disease with certain compounds, if you will.
Okay.
But it would be more of a chiropractic could be an approach for a migraine patient. Not all migraine patients. I would say the worse you are, the less chiropractic is going to work for you, and you need all these other things that we've talked about through this series. But one of the things that you can do, if let's say you're having a migraine in progress, these are all the things you can try. And so let's go through them like one by one. But
Sure.
there's a caveat to this, okay? And the big caveat is that if you try one of these things to stop your migraine in progress and it doesn't work, it's not going to work in the future. Okay. So it's just something you got to just go try these things and see if it works for you. If it works for you, that's great. You just found something that is low cost and safe that you can use to manage migraines. And so the first one I want to talk about is ginger.
Ginger.
Ginger,
And not
right?
ginger from Gilligan's Island, but we're talking the herb.
Yeah, not yeah. Was she
Or
a
I guess,
redhead? I would say not redheads. No,
yeah, actually it's a root, I believe.
the root. Yeah,
Okay.
yeah. So the root. So ginger root. If you take about 600 milligrams of ginger, powdered ginger in a capsule form, it doesn't really matter how you get it. But if you're taking 600 milligrams and you take that in that initial phase of when your head pain's starting, that may be a great abortive for you, abortive medication, if you will, or nutraceutical. The reason I say is because the studies show it's just about as effective as a triptan, and it's dirt cheap
Huh.
with no side effects. So ginger is one you should try. The next one would be air in the ear. So puffing air in the ear. And I know this sounds like just out there, like this guy's crazy. Like, what is he talking about? But there's actually some real physiology, neurophysiology of why this works. I'm not going to get into this like right now. But basically, you get one of those ear puffers, or the nose, the snot. I think it's a snot sucker you use on kids, right?
Yeah.
We actually have these in the office. We'll like just give them to migraine patients. But you just take that in the side of head pain. So if like your migraine, remember, if you're a migrainer, you only have head pain on one side. If it's all on the right side for you, puff some air in the right side, 30 seconds, try it. If it gets a little bit better, keep going. That's another one. The next one would be to use CBD. But the caveat here with that is it works better with THC up to the legal limit, 0.3. So I would highly recommend that if you haven't tried CBD to manage your migraines, you should try it at least once. And you should start on a higher dosage with THC because it works better with THC. It's also safer with THC.
Okay.
The other one I would suggest would be putting cold packs on the neck. And this is more of a strategy to control dilation of the blood vessels. And so this one's more of a mitigation strategy. It's not like a solve strategy. So those are my 4 easy ones you can do that are pretty inexpensive. The most expensive one there is buying good CBD. It's probably going to run you $150 probably for some good stuff for a bottle.
The ice packs, the blood vessels tend to inflame during a migraine, and that's what we're trying to prevent. And
yeah, so it's they're really just like changing in size, and that size change can cause the migraine to be worse.
Yeah.
And so vasculature doesn't cause migraines. That's what they've thought for decades. It's actually neurophysiology. But if we can control the vasculature, it helps us a lot.
All right. What else is going on?
So a couple other things.
Still have 2 minutes, so that's
a couple of things I want to mention.
Sure.
Just on that, that note of pharmaceuticals. The cost for some of the people to manage their migraines is astronomical. So I do take care of a good amount of my patients are migraineurs that are in my office. And so I have some that spend up to $1,200 a month on their migraine medications.
Wow.
And that's pretty expensive. And usually the ones that are spending that much can afford it. But that being said, there are a lot of other things you can use to mitigate or manage migraines that don't cost as much money. And some of the pharmaceuticals have side effects. And one of them is that you could have more headaches or more backlash migraines if you don't manage the medication appropriately. And so this is something that you should seriously, consider some of these tips, or just talking to somebody like me about how you can manage, your condition for much cheaper, because neurologist visits and high price medications still cost more than I do. And we would like.
And the cost of ginger or the cost of CBD has got to be a lot less than $1,200 a month.
Yeah. I mean, even going to see the neurologist once could cost you about, that's what they're billing for like an exam.
Oh,
about $1,200. I mean, that's their insurance, but depending on your insurance, that can be pretty expensive too.
If someone had more questions about migraines and what to do, they could be right in the middle of a migraine and give you a call. If someone wanted to reach out to Dr. Joseph Adams, the Mansfield's foremost expert on migraines is what I call him. How can they get in touch with you?
Yeah, the best route would just be to search for us on Google. We're all over the internet, and we do have people that call us in migraine in progress, come in the office, and we're able to give them relief. And we do that without even, do that really quickly. We make that because we know how bad it is, so we can get them in and knock it usually in half pretty quickly. So yeah, just reach out on any of those channels, and we'll be happy to help out.
Dr. Joseph Adams, again, Calibration Chiropractic and Functional Health, right here in Mansfield, Texas. So if Easter is this Sunday, that also makes today Good Friday. So happy Good Friday to you and
Thank
your
you, sir.
family,
Yeah.
and let's do this again next week.
Yeah, let's do it.
Thanks for being here.
Let's see it.